There are 3 trials currently of adjuvant versus early salvage radiation therapy. I mentioned during the talk that there are already 3 randomized trials published which support the use of secondary radiation therapy after surgery for men with adverse pathology. None of those trials, however, got to the question of whether secondary radiation really needs to be adjuvant, in other words, immediately after surgery based on the pathology report alone, versus early salvage. Our practice pattern at UCSF tends to favor early salvage rather than adjuvant, so a patient with an undetectable ultrasensitive PSA, even if he has an adverse pathology report, often can avoid radiation therapy. This is where actually some of the best data for the biomarkers, and Decipher in particular, has been published. They're still not quite there as far as being a true predictive test, but they are getting closer. And additional results there will be very interesting, as well as the results of these trials. The other space which is very important is really trying to get at this question of cytoreduction for metastatic disease. As I mentioned, the field seems to be, in a way, barreling toward this concept of cytoreductive local treatment for limited metastatic disease, but that concept really does need to be validated in randomized trials. There is one ongoing that MD Anderson is leading with a few other centers, including UCSF, the results of which should be out in another year or 2. And there are similar trials in Germany and Australia, I believe, which hopefully we'll see the results of sooner. And I believe one in Sweden as well.